Hi, I'm Brian. I'm your host with Inpatient Podcast.
Hi, I'm Anna.
I'm Adela.
And I'm Brian. And today we're going to talk about infectious disease called
COVID.
I mean, COVID's been insane. So COVID, of course, for anybody who's been living under a rock, COVID is an infectious disease called SARS-CoV-2 virus. SARS, of course, meaning severe acute respiratory syndrome, because COVID essentially just affects the lungs, makes it harder to breathe, eventually die, because it's inflaming the air. Obviously, it's a virus. It comes from originally animals, but it goes through humans and contact. For animals, it's actually called zoonosis.
What is that?
So zoonosis is basically the transfer of a virus from animals to humans.
Wow.
For COVID, it was the pangolin. At one point, they said it was a rat that came from a lab. At one point, they said it was a bat. Yeah.
Wow.
But obviously, it affects mostly newborns, elderly, sick, people immunocompromised, stuff like that. Obviously, orifice, blood flow, anything to get into the body or get out of the body is how it's transmitted and caught. And obviously, the big things that we need to watch out for is airborne, droplet, and contact for spread.
Yeah, that's right. So some precautions that we can learn are, for us health professions, we know about the PPE. So wear your gowns, wear your gloves, and your mask when you are in contact with these patients. Make sure that every time you leave the patient's room, you're washing your hands, hand hygiene. Some patients don't even know how to wash their hands, so we are needing to do patient education. Another thing that us professionals forget to do is the hand washing too. We're on the go. We are moving from patient to patient, but that's how it spreads. So we don't want that, right? So
we do have that year before us that got sick every other week with
COVID.
Oh,
yeah, remember that? Yeah.
They
weren't
surfaces.
wiping, but yeah. So make sure that you're always wiping your surfaces. Another thing, vaccines. So if you want to stop the spreadness, make sure that your family members vaccinate. That also not just helps you as a person, but it helps the other people around you, so we're not spreading this virus.
I will say the one thing that I think hallmarks a lot of COVID was just anti-vaxxers.
I remember that.
That was a big thing.
Yeah.
We also need to practice sneeze and cough etiquette. And
that's another patient education right there, because a lot of patients don't know how to do that.
Not only patient, healthcare workers. Let's talk about the social effects. The social effects it had.
So yeah, remember telehealth?
Telehealth. It was a
telehealth. It's still around.
It is.
Yeah.
It's advancing a lot.
Oh yeah.
Before
COVID, now there's these little boxes that they send up to your house that they hook up to the body. It's really cool.
Whoa. I did not hear about that.
Yeah, me neither.
I didn't hear about it before COVID.
But for us OT practitioners, now we can do therapy on telehealth.
Of course,
Wow, that's amazing.
We can see our patients through Zoom meetings and help them.
Yeah. Another things that we notice with our kids is the kids' developmental stages. They're regressing. They don't have those social skills.
Yep. Social skills, everything at school, it's all.
Yeah, remember, because they couldn't go to school.
Well, not only that, didn't you say something about how the technology was changing for like testing and whatnot?
Yes, so my daughter's in 3rd grade. It's first year. She's gonna be doing STAR. But remember when we used to do the task? It was written.
I used to do the STAR, but it was written.
Yeah. Well,
See, I
now.
did tax.
Yeah.
Oh,
So now it's not written. You have to do it online.
online.
So 3rd graders are typing now essays, little essay questions.
I would have killed for that when I was like,
Yeah, and then everything's online now.
Everything's online.
So Aaliyah's doing online homework.
Sounds like 3rd graders are starting to get tech savvy.
Yeah, but it also affects them in their social skills. They don't know how to interact. They're like acting at a lower level. How did they? They shouldn't be at that level. They should be a little higher according to their age. But that's one thing that teachers and OTs at the schools are seeing.
Yeah.
Yeah.
Well, I mean, it's affected a lot socially. I mean, even if you go into the grocery store, you don't have free samples anymore. It's like you go to this kiosk and you order something. When you go to the cash register, if there's somebody at a cash register, they've got like that huge bulletproof glass looking thing that you have to slide through.
Yeah. I've seen those at
A lot of that's changed.
Yeah.
Yep.
So let's talk about if you do get COVID.
If you do get COVID.
So if you do get COVID, Brian, what's one thing that you should always wear?
If I get COVID, there's going to be the N95 mask. Obviously, that's going to cover me. Honestly, I'm going to try to stay away from everybody. Last time I got COVID, I felt so miserable. I took my little medication pill, I took an Advil PM, and either I was going to die or I was going to get better, but I wanted to sleep through it.
Yeah, so isolation. Remember, we have to quarantine, stay in our house.
I've never had COVID, so I've never had to isolate
Wow,
myself.
you're lucky.
You are lucky, because like right now my folks, I had it twice too, but my folks have it right now, and literally all I do is I take stuff to them. They stay in their house, I drop stuff at the door, and I run before they can open it, just to kind of keep them safe, but make sure they have what they need.
Even at home, when we're isolated from everyone else, you gotta make sure you clean your surfaces, make sure you washing your dishes with hot soapy water, and then make sure that you're using a separate bathroom from everyone else. That's one of the big